Hello, everyone, and welcome to another episode of STEMmy Conversations, where we talk about all things STEM and ICT. My name is Kenita Roberts, and I will be your host alongside me with Bradley Downer. Today's episode, we'd like to welcome Miss Ramona Chanderballi to our platform. Miss Ramona is currently the Vice Chair of the Allied Health Professionals Council, Guyana, which is the licensing body for all allied health. She is the sole U.S. board-registered cardiac sonographer in Guyana through Cardiovascular Credentialing International, CCI. Ms. Ramona's passion for increasing access to medical imaging services across Guyana, as well as advancing imaging technology and competency, has driven her towards being trained in radiography and contrast studies, as well as her current core area of expertise, echocardiography and adult congenital heart disease. Ms. Chanderballi is the holder of a bachelor's degree in medical imaging from the University of Guyana and a postgraduate diploma in echocardiography. She has served as the senior echocardiography technologist at the echocardiography lab at the Georgetown Public Hospital Incorporated in Guyana for the last 5 years. Ms. Ramona has been a member of the American Society of the Echocardiography, ASE, for the last 4 years. She is currently the International Society of Radiographers and Radiologic Technologists Council member for Guyana and sits on the World Radiography Education Trust Fund as a board of trustees. Most recently, Ms. Ramona attended the ASC Scientific Sessions, which was held in Washington, D.C., as the first registered cardiac sonographer from Guyana. Ms. Ramona continuously advocates for quality, accessible, and affordable healthcare solutions for Guyanese. Welcome, Ms. Ramona Chanderballi to the stage. I think my tongue got tied up with that echocardiography word.
My goodness, thank
So
you.
please
Didn't
forgive
expect
me.
that. That's
Thank
okay.
you for
It's very
being
wordy.
here.
It's my pleasure.
Yes. So my first question to get us started is, well, I would have mentioned the career all the time, but for the purpose of our viewers, what career did you pursue and what does a day in your life for that career looks like?
So I started off as an X-ray technician. I was fresh out of high school, and I wasn't sure what I wanted to do. I initially had gotten into lower six law, and I realized by the end of first year, I really didn't like it. It was fun. I had an aptitude for it, but I didn't like it. And I think my uncle had mentioned there was a training at GPHC. So I started working as a clerk and I got into the training because I had the relevant CXCs. I went to the Bishop's High School. And a year later, I graduated from the X-ray technician training program. And then I worked for 3.5 years. And then they launched a bachelor's degree in medical imaging at the University of Guyana. As luck would have it, as soon as I finished that first degree, I had applied for a few options because, again, I wasn't sure what I was going to do after. And I got into the adult echocardiography program. So I did that training for an additional 13 months. So it was back-to-back training, which was almost about 5 years, actually a little bit over 5 years. And then I started working as an echo tech. Basically, I do ultrasounds of the heart, but I also have experience in performing x-rays, using contrast studies in x-rays. I did a bit of mammogram, dental x-rays. I have worked in the operating room with an orthopedic team when they're doing surgeries. I have worked in the ICUs. I have worked in the burns care unit. I have accumulated quite a bit of experience over the years. But my day-to-day currently is I would do ultrasounds of the heart. We're the sole cardiac center in the public healthcare system, so we cater for all of Guyana. Our patients come from every corner of Guyana, and I am so happy that we're able to provide those services for them because I think last month we had a patient that came to us after defaulting from clinical care. Her last imaging study that she had was an X-ray in 97, and unfortunately, X-ray has its limitations. So we were actually able in November to finally diagnose this patient using echo imaging. So that is a huge plus for us. But what I do is just like an ultrasound of the tummy, except I look at the heart. But the heart is beating. We can't stop the heart just to do this test. So I have to be able to capture diagnostic images whilst your heart is still beating. And some of those images can help us to find if there's any damage after a heart attack to the heart walls. If you've had any injuries or any condition that pre-diagnoses you to a valve disease. We have quite a few patients who would have had rheumatic fever when they were much younger, and over the years end up with rheumatic heart disease where it blocks one, it basically closes up one of the heart valves and blood doesn't get to flow properly. So we're able to diagnose that and we're able to refer those patients to surgery, and they're able to have their surgery and lead a normal life. Their quality of life improves after that. We also are able to track congenital heart defects, which is the holes in the wall and in the walls of the heart. And depending on how soon we catch it, we're actually able to have surgical intervention. This past weekend, one of the surgical teams left the country after performing, I think they did either 8 or 10 open heart surgeries on children with congenital heart defects. Some of these children would have had surgery that would have essentially not corrected, but fixed a lot of their issues. So when you have open heart surgery, it's not a complete fix. You still have to see a doctor. You still have to be followed up in a clinic, but the quality of life improves significantly. So in a nutshell, that's a bit of what I do. I usually see patients as soon as I get in, all the way up until and I come off. And in addition to actually performing the studies, I also do a preliminary report, and my cardiologist overviews and makes any additional adjustments or corrections. And they're the one who gives the diagnosis, but I'm able to actually perform the study and help them to see what's going on inside of a patient's heart so they can better treat and recommend patients for further intervention.
Okay, that sounds like a very, very full day, a very full and productive day. And I'm happy that, Guyana is providing those services. I remember when I went to the energy conference earlier this year, they were very proud to show off that, Guyana can perform open heart surgery, and they show us how the blood is run on a bypass. I should have the right
Yeah.
word because I watch Grey's Anatomy, but yes, they had the whole model and everything. So when you were talking, I felt like, I could have connected with what you said. Okay, so how is science, technology, engineering, and mathematics incorporated into your field?
I think I'm quite possibly going to have a field day with this question. If I do go a little bit overboard, let me know. But also, thank you for having me on here and talking and incorporating this particular question, because a lot of people don't realize just how heavy of a science field this is. All the times when we think of STEM in healthcare, we think of doctors, predominantly doctors, or the next one would be biomedical engineers. But imaging in particular is driving one of the driving forces in a lot of technological advancements, especially in the sectors of AI, 3D printing, and uh, where they have the goggles and you're able to reconstruct stuff. we're one of the driving forces for that because we generate those images that are then constructed either into a model to be 3D printed or into VR. So the surgeons can have, detailed information to plan the surgery ahead of time. As for Guyana, I actually recently did a talk at Bishop's for their student conference, and I was so happy to tell the kids that one of the ultrasound units that I have in my lab literally is the same exact model, a replica, another one of it is what's being used in the International Space Station to do ultrasound. So when you go into space, because of the zero gravity, your heart shrinks. They've conducted studies over the years and they found that the heart would shrink. So they actually take an ultrasound unit into space, and we have actually two of those now in my lab, the same exact model that we use to do ultrasounds of the heart on patients. So the kids are like absolutely blown away by that fact. But we also train astronauts. The sonographers in the US, they do a 6 weeks crash course with astronauts so that when they go into space, they're able to perform these studies on the guidance. So the amount of physics we do is relentless and you never stop. Physics is probably, I would say it's almost the core. It's 50% anatomy, 50% physics, and we throw in a 10% patient care because we do have a lot of face-to-face interaction. We do have patients with us for a prolonged period of time, so you have to be able to calm them and speak to them and get them to cooperate. So you do have to have a lot of customer service, bedside manners. But I have been doing physics since I started in this field. The core of my studies is physics. I was actually talking to one of our cardiologists. We were discussing blood flow in the heart, and she summarized it so perfectly. So we call blood flow through the heart the hemodynamics of the heart. And she summarized it as hemodynamics is the physics of blood flow in the heart because blood flows through the heart through a pressure difference. And depending on what's going on in the heart, that allows the blood to flow. That's your heartbeat. It's a pressure difference. So there is so much physics, and that's the anatomical part of it. There's the equipment, there is the imaging physics to it. We do ultrasound physics, we do the production of x-rays, we do MRI physics, we do fluoroscopy. All of those, we have to study the physics of it in order to be able to function in our jobs. And even the entry level, which was X-ray technician training program that I did, you have a core physics component and you're doing physics from the day you start and you're still learning it as you're studying. For example, for me, I do the ultrasounds, but the physics applies to me because I'm still calculating the size of a valve area for my surgeon. So they can know if the valve is functioning well, if it's a timeline that they need to keep a closer eye on, that this patient would need surgery sooner rather than later, depending on how much the valve is opening and closing. And for my physics, I have to be able to manipulate the equipment in order to get the best diagnostic image possible without having any interference, without having any artifacts. And I have to know if I have an artifact on my screen. Is it from the patient? Is it an equipment issue? Am I not putting my settings right? All of those we have to correct. The maths is unreal. I remember we had to do, well, it is a bit of physics too. We had to do the equation for X-ray production. And I think it was the first time in my life I've used like two, those massive blackboards, the whiteboards that are the size of a blackboard. We went all the way through, like the entire equation of it. And the funny thing is, that same conversation with the cardiologist, that's how we came about talking about the physics. Because I'm like, the same way X-rays are produced is very similar to how you look at aortic stenosis of the heart. Because the valve would be like, let's say it's normally this size, it would become this small. And you have a pressure difference going straight through. So in order to understand how that's affecting the heart, you have to be able to, I guess, generate how much volume and pressure is going into the heart and how it's affecting the heart in order for it to function. I always ran out of time for my physics exams because you're doing so many equations because you have to know all of them. Continuity equation, Bernoulli's, and I forgot the other one, but those are my everyday. They're my bread and butter. I know them by heart. I have to be able to calculate a heart valve because sometimes I might take a measurement and I might take an extra one and it might deviate what my equation would end up with. So I'd have to manually put pen to paper and actually go through if I don't think my equipment is doing it right. The science, well, I did go into the physics and the maths, but the anatomy. So like I mentioned earlier, the heart is beating. You can't stop a heart. So you have to be able to understand the different patterns. So when you have an electrical issue, we did a little bit of electricity from the physics, so that still comes in here. When there's an electrical or a conduction issue with the heart, it means it has a different rhythm. I think we know that we shock people to get them back into rhythm. It's pretty much it's a practice, but it's well controlled. It's a specific voltage. We have a cardiologist involved. But if that rhythm is off, we have to be able to compensate what's going to happen to the heart because of that rhythm being off. Because the electrical pulses in the heart is what causes the heart to squeeze. That triggers the rest of it. So we have to be able to know, is this a normal rhythm? Is this an abnormal rhythm? If it's abnormal, how is it causing the heart to function? What are the complications of this abnormal rhythm? Then there's the muscles of the heart, there's the blood flow of the heart, there's a valve. You have to know each bit of the anatomy. And aside from the normal anatomy, you have to know the abnormal. You have to know, for example, I didn't know you could get syphilis of the heart. I knew you could get it of the brain, but having been in the field so long, I now know what syphilis does to the heart if it's untreated long enough. Please get your penicillin shots. They're available everywhere in case you ever test positive. It's just a penicillin shot. But yeah, you have to know what's normal, what's abnormal. Then my favorite one, which is the adult congenital heart disease, it takes normal out the door and it takes abnormal along with it. Because now you have, let's say, a hole in the heart, the hemodynamic changes entirely, the anatomy changes. You have to identify each part of the heart based on the anatomy to say, okay, this is the right heart, this is the left heart, this is this valve. You have to identify each bit of it. So you have to know a ton of anatomy. And then you have to correlate it to putting each bit together to form the actual heart. I might have gone off a little bit on there, but I absolutely love that question.
Okay, so the physics part was very, very surprising. And the extent to which the physics went, very, very surprising to me.
Yeah,
And
it
another
never
thing that
ends.
came to mind while you were talking is, pardon?
Sorry, the physics never ends. Like I thought I'd
It
be
never
finished
ends.
in
Hmm.
ultrasound, but no, it actually got I think quite possibly the less radiation you use, the more physics you have to apply.
And the next thing that came to mind is a lot of critical thinking in your
Oh
field,
yes.
which is
Yes, you
good.
have to
And I
think
think that would
about
apply throughout your life. So
that. Mm-hmm.
good stuff. Bradley, do you have anything you want to come in and ask or say at this point?
I think I can relate to what she's saying because when I was in environmental health, my colleagues who did extra administrative health, they had to do a lot of physics. They
Mm-hmm.
literally had to. There are days when you'd see them, oh, we have Miss Petal today, and we're doing
Oh
physics.
yeah, she taught me my entire career. I think the only time she didn't teach me physics was when I was doing the echo program. Now I actually teach the students.
Wow,
That is a full circle moment.
Oh
correct.
yeah.
It is.
Okay,
So
so the question I want to ask you, oh, Bradley, you
go
can
ahead,
go.
go ahead. I'll do
Okay,
mine.
so um, you talk so much about, the heart, and you seem very, very passionate about it. And I know you have to be passionate about it. And you mentioned from the beginning that, you started law. So I wanted to know if you were not a echocardiographer or radiologist, what did you think where do you think you would be?
That is a trillion. So funny enough, I didn't think I'd be here too. That I think I should put that disclaimer out. I did not see my career going this far in Guyana. I'm entirely educated in Guyana, so that I'm excessively proud of that. I will go and shout it on the rooftops. I did my entire education in Guyana. I didn't leave the country for any of it, and now all of our programs are sustainable, and we're starting to take in students from the Caribbean because there's no other echo program in this part of the world. We're the first in the Caribbean to have a program run through the University of Guyana to have accreditation. Honestly, I know a lot of people ask me if I consider medicine because of how much I like doing this. I don't think I want to be a doctor. I actually like what I do. And even looking back now, I don't think I would have stuck with law for very long, even if I did go through with it. I might have done something with my hands, maybe some engineering or something, because there is a significant pull towards biomedical engineering. I would have considered that, but I like my interaction with my patients. I like not having to sit at the desk all day. So definitely something along those lines.
Definitely love how you found your passion. And I love the fact you're very passionate about it. And you're teaching and, bringing others along with you, which is really great. And it's definitely, I'm sure you would see that, we need more of that. And I guess that's a need that you're
Yes.
trying to fill.
Mhm.
Yeah. So, Bradley, handed the next question to you.
All right. So my question would be, what are some obstacles or challenges you faced at university or your job,
Mhm.
and how did you overcome those challenges?
So I have the interesting experience of being a guinea pig. I but I was always a part of the first class. So the extra technician program has been running again, I think, since the 90s. It's a very old program, along with all of the other assistant programs at Ministry of Health. But I think they revamped them the year we joined, which should have been 2009. So all the programs went through course review and they upgraded them, and kudos to the ministries, in particular Ministry of Health, for doing that, because it's absolutely necessary, especially for the outlying regions, to have all of these different allied health professions. Um, we were the first batch. Honestly, I think they did an excellent job with that one. I did have a lot of struggles at university. We were the first batch for the bachelor's degree. There were a lot of things that we had to, I guess, more or less learn on the spot and to navigate as students and as a faculty. There have been improvements. One of the things I must commend the university for is having the old students who would have graduated the program to come on board when they're doing the curriculum review. I've been part of that, I believe, twice. Basically, we go out after we started working, we meet back with the university when they're doing the curriculum review and recommend these are areas that maybe you guys need to improve on, or these areas are where we fell weak when we started practicing. Um, I'm honestly going to chalk up a lot of my university experience to the program running for the first time. And partially because I think at that point when we started the program again, I wasn't necessarily in a position to fully accommodate what the field would have grown into. So I think it was a learning and a growing experience. It has improved. There's still room for improvement. I'm still going to heavily advocate that they need to have a DICOM system in place. We used a free open software which had limitations on it. So I do think the university should invest in that, because we're digital now. Finding films in this day and age is very hard. My lab went fully digital back in 2019. We have, down to our reports can be generated in PDF form. So we're almost going paperless in my lab. The only reason we use paper is because we don't have an electronic medical record system in places yet. But we have to prepare these students for the world that they're going to be working in when they graduate. So we cannot keep limiting them to what currently exists. We also have to plan for what they're going to meet when they go out into the world. The ECHO program actually was relatively decent because it was run in partnership with Libin University. Libin Cardiovascular Center in Calgary and University of Calgary and Mohawk College in Toronto. So we had a lot of international support. The program was run, it has been running since 2013, but they took on a lot of, it was originally designed for doctors, but we realized that due to a lot of limitations with their schedules and the duration of an actual scan, we weren't getting as many echoes done by the doctors. So it was better to have the sonographers come into play. So another part of my guinea pig experience, when I joined the program, they also realized that persons came in better equipped with a bachelor's degree because we would have covered a lot of the anatomy, a lot of the physics. We would have done a full year of ultrasound. So we come on with that knowledge prior to having to start a program. So we're not doing basic core stuff. We already come in with the knowledge, and we're just specializing in echo, in cardiology, basically. So that changed the whole thing after. So now to get into the echo program, you have to have a bachelor's degree in medical imaging. They also accept the bachelor's degree in nursing, bachelor's degree in chemistry or biology, because it has the background that's necessary. Looking back, I am honestly proud of how far all these programs have come. I have been rather vocal on some of the issues I've had. Um, and I'm glad that the person's listened. I mean, we still have a far way to go. I hope that we get to a point where we have enough people in the fields. One of the things we are incorporating, as I mentioned earlier, is that we do know that we can't oversaturate the field with too many people. So we're also having international students join the program. Basically just preparing for the digital age. I think we were underprepared in most fronts and almost all the programs I did. We were still very paper-based, still very film-based. But again, as the changes are happening within the hospitals, it's happening within the program. So there's like that ripple effect that sort of mitigated that. As for the job, so when I came on with a bachelor's degree and a postgrad diploma. So I was the first female cardiac sonographer and the first cardiac sonographer with those qualifications in the country. So one of the first issues was, what do we pay her? That was an uphill battle. I think most Guyanese in healthcare can relate to that one. Thankfully, as of this year, we finally negotiated to what we wanted. But I do think, and this is something we've been addressing on the Allied Health Professions Council as well. We are planning ahead. We're not going to assume that any of the allied health fields are going to be stuck at where they are. We are anticipating growth. We are anticipating specialization, and we're planning. So hopefully by next year, we'll have some amendments in Parliament to update the Act. That's a personal goal of mine. I've wanted that for a while because I'm only licensed as a medical imaging technologist. I'm not licensed as a cardiac sonographer. My US board registry is what says I can basically practice echoes, but within Guyana, I am limited to license for a medical imaging technologist, which within the law, it does cover me, but I would prefer to have it as a cardiac sonographer because I don't do all of the modalities. I'm actually subspecialized at this point. But I will say we are going places. There's a lot of change in mindset within the field. That's the one that I'm the most proud of because a lot of things can happen outside, but if within the fields there isn't that mindset change, and I've been in this field since I was 17. It's almost, I think, 15 years now. So I've watched the field grow and progress, and I appreciate how much the core community of itself is actually pushing. So those issues are being addressed on a more holistic approach, where back in the day it was just one person or a handful of people trying to address the need.
Well, I know that being the first of everything could be a little bit, I would say, scary, but you definitely handled it really, really well. And I'm happy to know that, they're improving the pay. Slow but sure, slow but sure.
We've started.
Okay. So I want to say my last question is, what advice you would give to persons who would like to pursue your field of study?
I think I'm gonna have to compete with my first question now that I said I loved about the physics and the science. And this one is, I didn't, so this year, this graduating class from the university, the bachelor's degree in medical imaging, the best graduating student was someone I convinced to come into the field. And when she did her thank you, I was in tears. I couldn't help it. It was just like me. She was in high school, she had just finished, and she wasn't sure what to do. So her uncle knows me. We are a really close family, and I was telling him that, this is an option. She can pursue this, and this was my experience, and things have gone better since I've graduated. And she joined the program 4 years ago, and this year she's the best graduating student. Um, I will say it's challenging. I'm not gonna lie. I failed ultrasound in final year. I will tell everybody that. I have 6 failed grades from university. I am not ashamed of it. I was not the best student academically, but I absolutely love this. So I will say that there were times I skipped classes, there were times I cried. I seriously considered dropping out in third year. I spoke to friends who had dropped out of university. I was literally about to say I'm done, and I'm glad I didn't. The experiences have taught me to be a little bit more resilient, to be able to figure things out. Like you said, I have to think on my feet. So that kind of built up to me being able to function now. But there are resources. You're not alone. Everyone feels that frustration. It is a lot of information to consume and to be able to use. Because as you're getting this information, as you're performing these studies, you have to be able to analyze it. And if, let's say, a doctor comes and asks, or if someone wants information from the image you would have gotten, you have to be able to at least say that it's normal versus it's not normal. So you have to keep thinking on your feet. It is incredibly rewarding. Like I said, it's been almost 15 years, I believe. I have gone through all the training programs in the country. I have worked at all levels. Um, I I think I was struggling to say what I would have done if I wasn't doing this because I haven't thought of anything else. Um, it is an incredible opportunity to grow. There's amazing room for growth within this field, and that's one of the things I absolutely love it for because I was an X-ray technician. I was a radiographer, and now I'm a cardiac sonographer. I've been able to grow over just over a decade, and you can do all that in Guyana. So if you're thinking, oh, I'm just going to be stuck in one position, no. And all of these training programs, the X-ray technician training program, the bachelor's degree in medical imaging, and the adult echo program, they all are they have government scholarship options, and I took them. The only thing I paid for was my bachelor's degree because I at that point I'm finishing off my second contract actually. I am debt free. I have a pretty decent salary. It's competitive. I can safely say that within Guyana. My qualifications enable me to pursue further studies abroad. My qualifications allowed me to be registered with the American Board Registry, and I can work in any parts of the world. My all of what I've done in Guyana makes me competitive globally. So there is so much, and that's just one area. We haven't talked about specialization in CT, or hopefully soon we'll have a conversation about specialization in MRI. And even within echo itself, up to last week, I was working with the open heart surgeons because they were using what we call a transesophageal probe, and I was the only person who was trained to basically take care of that piece of equipment. So there's so much, and I will say this, one person can't do it all, and I can't do it all. I'm old news. There's an amazing and incredibly bright younger generation, and I'm excited for what they can bring to this field. I'm waiting patiently to see what they do.
And I definitely hope that this video would help someone who can consider your field of study and contribute to, the new generation. Bradley, do you have anything you had want to say? Any questions or so?
My last question, or my second to last question, matter of fact, would be, what does success look like for you, Ramona?
Oh,
Or you're
I
successful in your job?
funny enough, I actually have an answer for that one. So I think coming out of the pandemic, I had asked myself that question a lot because the pandemic forced me to slow down career-wise. Like I usually plan 5 years in advance. I have career goals and I try to accomplish them. And the pandemic put me back almost 2 years because everybody went into shutdown. Um, I was only able to sit my registry exam this year because of the pandemic, because there was lockdown, you couldn't travel. I couldn't write the exam in Guyana, so I had to be able to travel in order to do that. My simplest answer is I have one patient back in 2018 when I just started. He was not doing very well. He didn't know what was going on. He was getting consistent shortness of breath, and no one could figure it out. So he came to us. We did an echo. We followed him up over the years, and we were unable to fit that last missing piece of the puzzle. We got him onto one of our surgical lists, and I think it was earlier this year. He had a surgery done. He had a very rare condition. He had a hole in his heart that was created due to an infection. It's very rare. Even the surgeons who did the surgery, they're calling their colleagues back in the US and they're like, you would not believe what I just saw. And he had his surgery done. He's doing much better. And he knows my name because of the amount of times we've seen each other and the amount of times I've told him, please take care of yourself. He would not pass me anywhere. And the fact that he's able to have a really good life, like he has a new lease on life. He was losing a lot of weight just before surgery. He was not doing well at all. He was in and out of the hospital. Now he's walking, he's shouting for me across the road. Like that's it. That's success for me. Nothing else.
I love that response. I love that, honestly. So my last question would be, what do you think about networking and building relationships in your job as I think it's a radiologist?
Cardiac sonographer. So I will shamelessly plug this in. Radiologists are doctors. I am not a doctor. So they would have done medical school and then do a fellowship in radiology. I am plugging that in because even within my field, a lot of people, even some of our doctors, make the mistake of saying radiologist. Sorry, I got distracted. Can you please repeat the question?
Sure, one sec. I think it was talking about networking. One second. What do you think about networking and building relationships in your work as a cardiac sonographer?
Yes, that's a beautiful question, actually. Man, you guys have the best questions. I need to come on more often. Okay, so networking. I will say this. I would not have dared to dream this much and have been able to accomplish and do this much if I didn't have a strong network, even within the field. I was lucky that my research paper from university was selected by the International Society of Radiographers and Radiological Technologists back in 2018 to be the only poster presentation from Guyana at their World Congress in Trinidad in 2018. That was the first time I think we had 7 presentations. Mine was the only poster presentation, and there were 6 other presentations that the persons presented on stage. That was an incredible experience. I think I can safely say that a lot of the traction I gained in making progress in what I've done and advancing my career came from that experience. And I was able to not just network with other societies, I was actually able to network with an incredible set of people, including one of the persons who helped put together the bachelor's degree in imaging. She was one of the persons who wrote the program from Monash University in Australia. So that's how we were actually able, like, I keep having incredible full circle moments. It's been wonderful. But being able to meet her was an absolutely incredible experience. I was able to meet one of my mentors in person, Chris Steelman from the US. Excuse me. He has been a driving force in my career in cardiology because he's an interventional cardiac specialist and he teaches. So I've had amazing people push me. He's guided me through so much of my cardiology career. I have been to sit on the WRETF board as a board trustee for the last few years. The WRETF grants funding for radiographers across the world, any country in the world. You're able to get 750 pounds, as in UK pounds, to travel to a conference. And we fund that. You're able to get that in your pocket to pay for your hotel or your airfare. I've been able to speak about the impact of COVID-19 in Guyana and the medical imaging community. I've been able to write for the ISRT. I've been invited to write for journals. I have been invited to publish after university. I actually have my university paper is still in the works of being published. I've been lazy with that, but I've written and published after I've graduated an update on Guyana and medical imaging and where we were at. Hopefully someone goes and writes a more updated version because this was 2018. A lot has changed since then. Locally, it's been an amazing experience. I will say maybe because of when I started in the field, I was able to meet a lot of the doctors when they were now starting their specializations as well. So I've been able to network with a lot of people who are now directors. I think we were all young and learning the ropes around the hospital. So now I have incredibly professional and cordial relationships with all of my doctors because there's a level of respect of having, I guess, been in the trenches when we were much younger. Like you've seen where things are then versus now. So I can reach out to my doctors and I can say, hey, your patient is not doing so good, or I've seen X, Y, and Z on your patient. You probably should consider this, or you're right about this patient. This is what's going on with them. As for within the medical imaging community, it's been awesome. Like I've got one of my friends into the well, we've known each other for forever, and she wasn't sure what to do. She was having a hard time with getting adequately remunerated for her degree. So I was actually able to pull her into the program, and she works with me at the lab as well. And one of my things is if I can do it, someone else has to be able to follow through because it makes no sense. I do it and it cuts off there, it ends there. That's not progress. That's not anything worth anything because no one else can follow. If no one else is following, we're not doing anything. I've also been able to, well, you've mentioned Petal. There's Fazia. There's so many other people I've looked up to who've been able to train me over the years. And now I can have conversations with them, people who can guide me. And of course, there's my cardiologist at GPHC. All of them are absolutely amazing. I can turn to them for advice. We work together as a team. There's that level of cohesion. And of course, my cardiologist abroad. I think I was telling one of my other colleagues the other day that I've been able to get training directly from some cardiologists that doctors within their own country cannot access. And that is a huge one. Like I didn't realize just how much my cardiologists have invested in my education and my training. So there's so many incredible opportunities. And even if you specialize, now we have an interventional radiologist. So if you're thinking of coming into imaging, you can have cath lab experience. You can do it for cardiology or you can do it for interventional radiology. There's so many areas you can go and specialize. And we desperately need that in the field right now. We need people to specialize. Like I said, one person can't do everything. We need more people. So if you're thinking of joining, there's so much space for you to grow and to learn and to build. And I don't want to be the only first. There's room. There's so much room here. Please.
Not gonna lie, the thought passed across, but maybe I should switch to that career. I'm in environmental.
Well,
You are
thank you.
very convincing.
Not just we work actually some of our work with environmental you do have to know some radiation because you guys use scanners.
Mhm,
You basically use the industrial grade version of what we use. So
mhm.
you have the core competency of it already.
Very convincing. Well, thank you, Miss Ramona Chanderballi, for speaking to STEMI Conversations this evening. I want to remind our viewers to check out our Facebook page at STEMI Conversations. We're also on YouTube. We're also on Anchor as STEMI Conversations. So do check us out. And thank you again for coming to STEMI Conversations. We greatly appreciate your presence, and we definitely had a lovely conversation. We are very close to 1 hour, and you know what that means. We had a great time. So
Thank you guys so
thank
much
you
for having me. I
again.
really appreciate it.